up in the room. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about three methods. What's three methods? Three methods to prevent knee surgery and natural pain management for knee pain. This has really come home to be very personal for me, Brad, because my wife is going through this right now. Very severe knee pain to the point where she had to use a crutch. And we'll talk about that, but now we're on the upside. Things are getting better. The crutch is gone, but I could tell you in some circumstances there would have been people that would have been heading down the road to surgery. I bet.
Sure. Well, I mean, Bob, you and I over the last 30 years have worked with literally thousands and thousands of knee patients, and I think we got some really good tips. Good tips that are going to be effective for
But before we do that, Brad, if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us, because Brad and I just discovered that every time someone likes us, an angel gets their wings.
Oh, wow.
Or a devil gets their horns. We're not sure which one it is, but let's start off, Brad. What are we going to do here?
The first thing with knees, and pretty much any joint, but with knees, because that's what we're talking about, is you want to maintain range of motion. You want to be able to make sure you can bend it all the way and straighten it all the way, because oftentimes with knee pain, there's associated loss of range of motion. So we're going to show you a few tips on that.
So it's not even maintaining, just maintaining. It's increasing, because
it's
very subtle sometimes. Brad, if you put both legs up on the stool, it's very subtle sometimes, but you'll see one, it might just be just slightly higher.
Right.
And if you have a loss of motion, if you regain that motion, it is going to help decrease your pain.
Right.
And my wife can give testimony to this right now, because she had just the slightest loss of motion, but by doing these stretches, she's gotten better.
Sure. And like Bob had a good point there. Put both legs up if you're sitting in a chair on another chair next to it and see if they're even. Usually the painful one oftentimes will not be able to fully extend. If that is the case, what you're going to do is, it's nice to have a rolling stool like an office chair.
Yeah, it is.
But you don't have to. Put it up there and you can just push down and stretch. And you're going to go pressure on, pressure off, usually 10 times. And you're only going to do this is after the 10th one, or as you do more, it improves. Sometimes you have to go to one side. In other words,
yeah, sometimes you have to turn it out. That's how my wife had to do it. She's pushing on kind of the inside of the knee there and pushing down.
Yep.
And
or you can go this way. And you could try all three, straight up, to the left, or to the right, and you're going to use the one that more efficiently increases the range of motion. And it'll be clear. I just worked with someone last week, and it was very obvious which way was the
one
way to
that
go.
feels best afterwards, too.
Right.
It might hurt while you're doing it a little bit, that's fine. Or it might feel better when you're doing it, that's fine. But it should feel better after.
Right.
If it's worse after, then this may not be for you.
Right.
So, and you can do these, by the way, even just, you can go up to a step and put your foot up on the step and do it this way too.
Sure.
This is a little high for me, but so.
The next one is the knee should be able to bend all the way like a normal knee. If you do one leg and it goes normal and the other one up, it sticks there. Well, this is one stretch you can do. Just simply sit and I like to bring your hands like this and see if you can pressure on, pressure off. Pressure on. Now this one too, you can take your toe and point your toe out and see if it goes a little easier that way. If these create sharp pain and it continues after 2 or 3 repetitions, it's not the right thing to do. Or you may have to wait till it settles down a little bit. Or you can try pointing the toe in. Okay.
And these can be done every hour, by the way.
Sure.
So you can do 10 every hour. Obviously, you can't maybe always do it every hour, but that's the indicator how often you can do it.
And that you're only going to do it that often if there's better.
Improvement.
It's
right.
getting better. Bob, do you want to show them?
Sure. I'm going to show on this, I think. What we're trying to do here is, this is a mulligan technique. So what you're doing, I'm going to show eventually on here, you're going to grab the lower leg here, and I'm turning it.
Sure.
Oops, wrong way. I'm turning it in. I'm turning it towards the other foot.
Okay.
Let's put it that way, okay? So I'm turning it towards the other foot, and while I'm doing that, I'm bending.
Right.
Okay? So if I show you on here, I'm turning it toward the other foot, and then I'm bending. You wouldn't want to do it on a stool like this because you're going to probably lose your
Right.
balance.
You want to have a now. Even if you had a steady chair, but you don't feel comfortable doing this for balance, don't do it.
Yeah, don't do it.
You don't want to
right.
fall.
Same with this one. I'm turning it toward the other foot, and then I'm bending it.
Right.
So, really an effective technique for some people.
Sure.
It really works well.
And this last one is a little one, but it can be important. And I'm gonna expose myself here in the leg area.
Brad.
Well, Bob.
Family show.
Well, you know, we're just gonna have to break the rules a little bit here. But the kneecap, when you put your leg up straight and you completely relax those quadriceps and that leg muscle, your kneecap should actually move up and down, right and left, diagonal this way and diagonal that way. And, you know, I've had people where they just don't feel, once you start moving their kneecap, they tighten up because
Right.
they feel it's awkward. So that can be challenging. But once you learn to relax, then you want to work that kneecap mobility. And this is, again, you know, might be a little uncomfortable at first, but it should improve and become very pain-free. If for some reason it continues to be painful and it hurts afterwards, it means the kneecap is not going to tolerate it, and then don't do that particular exercise.
And that one is a good one to, again, compare side to side.
Right.
You know, see if the painful knee is a little bit tighter, and that really is an indicator that maybe it really needs to be
Sure.
stretched. All right, Brad, what are we up to next?
Method
then?
number 2 is non-weight bearing exercises.
Yeah, very crucial.
So you're not going to go jogging with knee pain, and even if walking starts to irritate it, you're not going to do that either. Things like stationary bike, if you have one, water exercise. Bob, we want to talk about the cane and the crutch?
Yeah, my wife, by the way, did the stationary bike.
Okay.
And we actually set the seat way up so that there wasn't much bend of the knee.
Sure.
But she'd do it for like 10, 20 minutes. And so the other thing, very crucial, and this is a tough one for almost every patient we have, we'll tell them, you got to take weight off the leg for a while because knee pain tends to flare up and it calms down. And we want it to calm down. So, you know, either use a cane or a walker. And I can hear you all screaming out there already, I'm too young to be using a cane or a
Right.
walker. And that's what my wife screamed to me. So we got her a crutch because young people use crutches. So she just used one crutch. Now, this didn't stop people from asking her, what'd you do to your knee?
Yeah.
And she had to put up with that all day. But she was to the point where she could hardly walk. So
Right.
I think her pride went away. So,
This crutch is obviously way too short for
yeah,
Bob.
probably about close for you, isn't
Oh,
it?
yeah,
Pretty
actually,
close?
yep.
Yeah. So,
And we have videos on how to use a crutch or a cane. We're not going to get into it here, but don't be shy. If it takes weight off, it makes it feel clearly better. Use
Yeah.
it. It's a temporary
it's
measure.
a temporary thing, right? It won't last long.
All right.
You'll get through it.
The next thing is some other things that
Some other
work really
possible
well.
equipments, yeah.
Particularly, you know, if you got that, you know, you have arthritis, you know, you're probably a candidate for a knee replacement sometime down the road, but you want to extend it as long as possible. This is a really nice product that we found. It's relatively inexpensive, safe to use, and it really works that knee without really irritating it. And the nice thing about it, the closer you put your chair, the more it bends the knee, which is kind of nice. So you can vary that range of motion. This is called the end motion elliptical.
Yeah, we've got it listed down in our favorite products in Amazon.
Right.
So
It's actually designed, it's advertised for use as a standing device. But we found that if you put, well, we've got 2 1x here, but if you put 2 2x4s elevated approximately 3 inches, and you turn it around so this end is elevated, and you come from this side, it becomes very nice and easy on the knees. It actually works the ankles and the hips as well as the knee. So it's a really nice product, and I've had a number of patients, we use them in the clinic, and they want to get one for at home, and they do.
yep, I've had the same thing, Brad.
Yeah.
So-
The other nice product is this knee glide, which obviously we're very fond of.
Probably because we invented it. But
Right.
we got to warn you right now, it's been so popular we actually sold out. And so if you're watching this video, we're going to have more in stock by April 15th or mid-April 2018. I don't know, maybe you're watching this thing in 2019. Don't worry about it. We'll have plenty by then. But if you're watching it now, mid-April 2018, we'll have plenty in stock. And
Right.
this is what's nice about this. This thing, actually, again, real easy. My wife used this.
Yeah.
She put it up on its angle. The other thing about this is it weighs, What, Brad?
Little, just like 3.1 pounds.
I can do curls with my fingers with this. So
And it's tough. You can drop it from a roof and it's not going to break. So you get different angles, which is really
yeah, you can do
nice,
hamstrings or more quads. So
Yep.
we're proud of it, aren't we, Brad?
Yes, we are. We love this device.
Well
and
designed.
We use it all the time in the clinic. Now, the last thing is how to deal with some pain and without exercise, which is always nice because people don't always want to exercise. They just want to make it feel better.
Right.
So usually with arthritic knee, if it's just painful, has been chronic, oftentimes heat is better. But I have to admit, I have one patient, she has severe knee arthritis, and she loves the cold pack.
Well, my wife, she started off with the cold pack, Brad.
Sure.
And, you know,
So we're going to use
yeah.
heat or cold, whatever makes your knee feel better, not only while the heat or the cold is on it, but afterwards for the next half a day or whatever it may
Right.
be. So if you got a cold pack, get a nice squishy cold pack that you can wrap around your knee and get it in a comfortable position. A recliner is really nice. You want to be relaxed when you're using either heat or cold on it.
and even elevated.
Sure,
You could-
yep,
sure.
especially if you got some swelling. If it is swollen up, then you're going to emphasize the cold pack.
Right.
If it's not swollen up, just painful, then it's your choice. Bob, you want to let's talk about a hot pack that we really like.
Yeah,
because
this is really infrared heat, far infrared heat.
Yep.
This is Thermatex. My wife used this too. We used everything. We pulled everything out, Brad. And what the thing about this is it penetrates a lot deeper than normal heat. Normal heat is only a couple millimeters. This goes up to 60 millimeters or
2.36 inches. It's really going to get into the joint, and it's very safe to use. It's been
you do have to watch this, Brad. You still can get burned on a place like the knee with Thermatex if you don't, you know.
well, if you have a piece of a cloth, if you
Fine.
you have your pants on, you're going to be fine. You just don't want to put it directly on there.
Well,
for
I'm
long
saying
periods of
fall
time.
asleep and for 2 or 3 hours. I
Right.
don't want to do that. So, but this works out. What's nice about this is it can be used throughout the entire body.
Right.
So if you know once you're done using it with your knee, I use this every night for my upper mid back
Sure.
here.
Yep. I use it for my low back. But as far as the knee, it's got 3 infrared panels. You're going to put it down like this, and you can see how this is called the Platinum model, goes right around the knee. It has nice Velcro straps so that you can put it around the knee and it's going to stay there. And then you can watch TV.
Yeah, the nice thing about this, by the way, if you are interested, it's probably black on black. You probably can't even see it, Brad. Well, you got to do your white stripe, don't
Sure.
you? The nice thing about this is Thermatex is offering a discount code.
Yep.
We'll put that down below, and also free shipping if you use that discount code. So,
Right. Yeah, we've had a lot of nice compliments on it, and both Bob and I, when we first looked at these, we thought this
No.
is just another fad. But we looked in the research in it, and then start using it ourselves and on our patients.
we became big fans.
Yep.
Big fans. So, all right. I think we're long enough, Brad. It's 13 minutes.
yeah, I
man.
know we got to get out. We got things to do.
All right. Thanks for
Thanks
watching.
for watching.